So let's briefly look at the physiology. So that the ear is innervated, we mentioned this before. We've got your trigeminal nerve, your cranial nerve 5, your facial nerve, cranial nerve 7, the glossopharyngeal nerve, cranial nerve 9, and the vagus nerve, cranial nerve 10. These all have nerve endings which are reaching into the skin of the ear. And then we have the cervical plexus, which finds its way back up onto the surface of the ear. An astoundingly concentrated area of nerve endings. It's like a little bus terminal, if you like, where there's a lot of neurological input coming in there. So the neurophysiological model, the body is healing itself all day, every day. Like the human body has the potential to heal any known disease to man. So for chronic illnesses to actually maintain themselves and to not be self-healing, this disorder must be accompanied by some sort of altered neurological reflexes that transmit pathological messages to the higher nervous centers. So it's like a habit forming in the nervous system where it gets into a vicious loop, and instead of correcting those health disorders, it starts to ignore them and perpetuate them and, allow those to manifest. Until these dysfunctional neural circuits can be corrected, those somatic reflexes controlled by the brain will remain dysfunctional. Here we have the concept here. If we look at the little picture of the map there, we can see that there's the homunculus, there's the map of the body. To the left there is the brain, and down to the bottom is the man. So this man, for example, has got a pain in his elbow, so that information will be travelling back up through the sensory nerves, into the sensory cortex, into the homunculus in the brain. And then because that's showing up on that particular homunculus on the brain, it will also show up on that point on the homunculus on the ear. So the ear point, the ear active reflex point, will show up as active if we have the technology to determine that. And then if we then stimulate that, we're now reversing that loop. We're actually sending neurological input into that part of the cortex, and then the model is that we're now going to change the downward information to that elbow, which will stimulate changes and produce either pain relief or might actually activate and speed up the healing process. So another nice simple way of looking at this to understand it is what's called the brain-computer model. So imagine if your brain is a computer, and it's the best computer on the planet. So the ear is seen as the computer terminal. It's like the screen, so it's the peripheral access to what's going on in the computer. So when we're looking at the screen on the computer, we're not actually looking at the insides of the computer, we're just looking at a representation of what's going on the insides of the computer. So the ear similarly is a screen. So when we see different active points showing up with our assessment, we can see that those parts of the brain are active. And then the other way of looking at the ear is it's also the keyboard to the computer. So when you're actually now putting input into the keyboard or into the active reflex points of the ear, then you're gaining access into that motherboard, into the processes of the computer to make things change. Detecting the active points is like looking at the screen on the computer. So if you put an earring or a stud in your ear, or if you lose a part of your ear, you just lose that part of the screen, so you can't see what's going on, and as an access point you lose those particular keys on the keyboard, so you can no longer access it. So here we have our somatotopic map. So as I said, we have literally a street directory of your body on your ear. And so there's brain tissues are all represented in different points on the ear. There's master points which help to stimulate and balance whole areas. Then you've got your musculoskeletal system, all of your joints and vertebrae. You've got all of your organs and glands are all represented in different points on the ear. Guaranteed, if you could almost think of any piece of anatomy in the human body, then there will be a point somewhere on the ear that is able to access that particular tissue and organ. As you can probably gather from what we're talking about, auriculotherapy is not just a pain relief modality. While it can be very effective for pain relief, it's also about actually stimulating new changes and healing processes in the brain and hence in the body. But this is the same whether you're talking about acupuncture or auriculotherapy. So I often say to people when they say, well, why do I need auriculotherapy? And they'll often understand if you say, well, you can get the benefits of acupuncture without needing needles all over your body. We're just using the points on the ear. But it's the same kind of effect where we're trying to balance and harmonise and restore the internal function of your body. Not just about reducing the experience of pain, even though they can be quite effective for acute pain relief. That's the more immediate effect, where some people will literally get up and just have a reduction of pain or a loss of discomfort in their body. But then we're looking for more of that facilitating the natural healing processes in the body, so that delayed effect, that resultant effect of what we're doing. Trying to facilitate the natural self-regulating homeostatic mechanisms of the body. So we're not overriding things. We can't run a current into the ear which will turn a cancerous liver into a non-cancerous liver. It just literally helps to facilitate and to stimulate and to harmonise and to balance what's going on in the nervous system to improve the healing processes. From that point of view, it can sometimes diminish overactive bodily functions, and it can also increase underactive physiological processes. So some of the benefits of auriculotherapy: it is a great drug-free natural pain relief technique. I love having auriculotherapy in my practice, because if someone comes in a really, really acute state, I can adjust them as a chiropractor, but I can also sometimes offer them some quite effective pain relief almost instantaneously by providing auriculotherapy as well. As we've said, it can speed up the neurological healing processes that are trying to go on internally anyway, but sometimes they just need a bit of assistance and a bit of help. Great with sport and joint problems. So it also does, from research, improve the signs and symptoms of a significant number of internal disorders. As it doesn't mean it's going to cure cancer or get rid of diabetes, or it's not really a cure. It's about improvement. It's diagnostic. It sometimes helps to isolate dysfunctional internal systems and tissues. So I find this very useful in practice, where based on the active areas that you're finding, you're getting a window. You're getting a bit of a view of the way that stress and strain is concentrating itself inside someone's body, and that can help in terms of your clinical decision making. It's great for brain stuff, good for depression, anxiety, compulsive related feelings. One of the most common responses you'll get from people immediately after a auriculotherapy session is they'll say, I feel so relaxed. I feel so like I could just have a nap. I just want to stay there. I just feel, it's like they're bathed in a little soup of endorphins after an auriculotherapy sessions. It's got a long-standing reputation of working with addiction and helping people with their cravings and their withdrawals and their abstinence-based symptoms. So it can be an amazing ally in any recovery process, whether it be detox or whether it be ongoing rehabilitation. So the way I tend to look at it is it's literally giving you a window in to tell you where the body is storing its stress, and it helps to relieve that tension. So when you see those active points on the ear, you're literally seeing the parts of the nervous system which are really facilitated and are really getting out of balance and need some help.